the whole issue of radiation dose is something that radiologists take very seriously and have been working for several decades. So there are multiple layers to this. For the first thing is, when a request comes in to do a study on a patient, we want to make sure it's the right study for that patient. So whether the examination requires x-rays or radiation dose or not, we want to make sure it's going to give the results that the referring physician wants. The second thing is we want to make sure that even if it's the right test, that we do it in the most safe way possible for the patient. And that means using the lowest radiation dose possible. And if you take my area, for example, cardiac CT, the radiation dose from cardiac CT has come down over 80%, to the fact now that if you come to where we're practicing and anywhere else in Ontario where they do cardiac CT, the radiation dose now is a fraction of what you would have received 5 years ago. To put it in some context, living in a city like Toronto, every year you get 3.5 millisieverts of radiation dose. A millisievert is a measure of radiation dose. If you have a cardiac CT, your radiation dose will now be less than that. And so it's the equivalent really of living in Ontario for about 4 months of the year and getting exposed to background radiation. We're not satisfied with that. We're driving doses even further down using new manufacture techniques, using new kind of techniques that the manufacturers have been creating together, working with radiologists, so that we go even lower. So radiologists work hand in hand with manufacturers to get the radiation dose as low as possible.